This may sound surprising, but I have had patients tell me there are days when, as survivors, they forget that they have had breast cancer treatment in the not too distant past. Is this possible? Let us discover the characteristics of patients who have made this unexpected declaration so that we can mirror these traits to increase the chances of putting breast cancer treatment far behind us and help survivors live longer and live more. Our patient for discussion in this video was very diligent in attending her screening mammogram sessions. It was at one of these occasions that a new finding of fine white dots was noticed on her imaging. These dots are referred to as microcalcifications, and they represent changes in the breast cells. Having discussed the options for management of this new findings, she elected to undergo a stereotactic vacuum-assisted breast biopsy to understand the nature of these changes within her breast. Briefly, this procedure involves removing breast tissue in sections we call cores through a needle placed under radiologic guidance. As the microcalcifications extended over an area of 5 millimeters, all the microcalcifications were removed, and to identify the site of biopsy, a tiny marker was placed within the breast. Once it was confirmed that the tissue cores removed had microcalcifications associated with them, they were sent for pathology. It was after this evaluation that she was diagnosed with ductal carcinoma in situ, which is very early cancer. We discussed the options for treatment with her, and she was agreeable to undergo breast conservation treatment. This would comprise of a local wide excision, which is an operation to remove the marker with a margin of uninvolved breast tissue all around. Her cancer was diagnosed at such an early stage that it could only be seen on mammogram and it could not be felt on clinical examination. Doctors refer to this situation as an impalpable cancer. As a result, we needed to place a guide in the form of a localization wire just before she went for surgery. You would be able to make out how the localization helped identify the area where the cancer was so that it could be removed together with a clear margin. This was her appearance about 6 months after she completed surgery and radiotherapy. In case it is difficult to discern her scar, it is highlighted with a yellow arrow. Careful scrutiny of her left breast will show the slight darkening of her skin, which is the result of radiation. Please take note that this cosmetic result may not be the same for everyone. The techniques used to ensure good cosmetic results will be discussed in other videos. Several years after this patient had her surgery, when she completed hormonal treatment, she mentioned that she only remembers that she was treated for breast cancer when she received a telephone call from my staff members reminding her of her annual review. Often enough, she would forget that she had had breast cancer treatment. She had so many other medical problems like diabetes and kidney failure, and breast cancer treatment had been the least burdensome of all her treatment regimens. Many years after, she succumbed to a stroke, likely a result of her other medical problems. Throughout this period, her cancer did not recur. I am happy to say that she is one of my patients who was cured of cancer because it was detected early through screening, and she chose the treatment modality which allowed her to continue life as it was before her diagnosis. Her cancer never recurred, and she retained both her breasts for life. This is one of many patients who mention that they often forget they are breast cancer survivors. They feel normal and proceed with life as usual. There are other surgeons who have reported this about their patients as well, and you may wish to look up their videos listed in the description below. Please note that this video is purely for educational purposes and is not intended to replace a surgical consultation. Do see your doctor to discuss your specific clinical circumstances and for treatment planning. More videos are planned to tell the stories of patients who have mentioned they sometimes forget they have had breast cancer treatment. If this has been helpful, please click on the like button, comment below, or subscribe to this channel to encourage us to produce more content to help women help themselves live longer and live more. Looking forward to chatting again soon. Cheers!